I wrote a 3-page birth plan for my first baby. Almost none of it happened. I had an emergency C-section at 2 a.m. after 18 hours of labor. I was devastated. I felt like I'd failed because my birth didn't go according to plan. But here's what I learned after seeing hundreds of births as a PA and having 2 more babies myself. The plan isn't what matters. Today, I'm telling you what actually belongs in a top birth plan and what's just setting you up for disappointment. Let's start with the reality nobody wants to hear. More than half of all births don't go according to the plan. Some studies say it's closer to 70%. That doesn't mean you shouldn't make a plan. It means you need to make the right kind of plan. A birth plan isn't a contract. It's not a guarantee. It's a list of your preferences. Think of it like ordering at a restaurant. You can say, I'd prefer the salmon. But if they're out of salmon, you don't go hungry. You adjust. Same with birth. You can have preferences, but you have to be flexible when things change. And things change a lot. Baby's heart rate drops. Your blood pressure spikes. Labor stalls. The epidural doesn't work on one side. Your water breaks before labor starts. Birth is unpredictable. That's just the truth. So why make a plan at all? Because it helps you think through your options ahead of time. It helps your medical team know what matters to you. And it gives your partner something to advocate for when you're in the thick of it. But the plan has to be realistic and it has to be flexible. Let me show you how to do this right. These are the things worth putting in your birth plan, the things that actually make a difference in your experience. Pain management. This is personal. Do you want an epidural? Yes, no, or wait? And see, this is probably the biggest decision, and it's totally up to you. If you know you want one, say so. Put it in writing. I plan to have an epidural. If you know you don't want one, say that too. I prefer to avoid an epidural unless medically necessary. And if you're not sure, that's fine. Right, I'd like to see how labor progresses before deciding on pain management. All 3 options are valid. There's no wrong answer here. Also, mention if you're open to other pain relief, the birthing ball, shower, movement, IV pain medication. I wanted to try unmedicated with my second baby. I labored for 6 hours, then got an epidural. And I have 0 regrets. My plan said try unmedicated first, and I did. Then I changed my mind. That's allowed. Interventions. When do you want them? This is about things like episiotomy, Pitocin to speed up labor, breaking your water artificially. You can't prevent all interventions. Sometimes they're medically necessary, but you can express your preferences. Write something like, I prefer to avoid episiotomy unless necessary for baby safety. Or, I'd like to try labor without Pitocin augmentation first, but I'm open to it if labor stalls. See the difference? You're stating a preference, not a demand. You're showing flexibility. Monitoring continuous versus intermittent. Most hospitals do continuous fetal monitoring. Baby's on the monitor the whole time. Some women prefer intermittent monitoring. They check baby every 15 to 30 minutes, but you can move around between checks. If mobility during labor matters to you, ask about intermittent monitoring. Some hospitals allow it for low-risk pregnancies. Content unavailable. Your labor environment? Who do you want in the room? Partner, doula, your mom, a friend? This matters. Some women want everyone there. Some want only their partner. Both are fine. Also think about, do you want music, lights dimmed, essential oils if hospital allows? These are small things, but they can make your space feel more comfortable. Delivery preferences. Do you want a mirror to see the delivery? Some women love this, some hate the idea. Do you want to touch baby's head as it's crowning? Again, personal preference. Delayed cord clamping. This means waiting a minute or 2 before cutting the cord so baby gets extra blood from the placenta. Most hospitals do this now as standard, but you can request it. Skin to skin immediately after birth, putting baby directly on your chest. This is also becoming standard, but specify if it's important to you. Immediate postpartum. Do you want to try breastfeeding right away? Most hospitals encourage this, but say it if it matters to you. Vitamin K shot for baby. This is medical standard to prevent bleeding. You can decline it, but I don't recommend it. Just know this will be offered. Eye ointment for baby prevents infection. Also standard. Hepatitis B vaccine given in the hospital. You can delay this if you want, but you'll need to get it at baby's first pediatrician visit. These are the decisions that actually affect your birth experience and baby's care. Now let me save you some heartbreak. These are things people put in birth plans that either don't matter or can't be controlled anyway. The exact date or time. Unless you're scheduled for induction or C-section, you can't control when baby comes. I see birth plans that say, I want to avoid having baby on a weekend, or I hope for a daytime delivery. That's not how it works. Baby comes when baby comes. Specific staff members. You can't guarantee your favorite OB will be on call when you go into labor. Doctors work in rotations. Whoever's on call that day delivers your baby. You might get your OB. You might get someone you've never met. That's hospital reality. Nurses rotate shifts too. You'll probably have 2 to 3 different nurses during your labor. You can't control this. Don't put it in your plan. Guarantee of no interventions. I see plans that say absolutely no C-section or no 4 under any circumstances. I understand wanting to avoid interventions, but sometimes they're medically necessary to save your life or baby's life. You can say you prefer to avoid interventions, but you can't refuse them entirely if there's an emergency. If baby's heart rate drops and stays down, you're having a C-section, period. If you're hemorrhaging, you're getting an IV, period. Safety trumps preferences, always. Vaginal birth guarantee. You can hope for vaginal birth. You can plan for it. You can do everything right, and you might still end up with a C-section. 25% of first-time moms end up with C-sections. That's 1 in 4. Sometimes it's because of fetal distress. Sometimes labor doesn't progress. Sometimes there are complications. You can't guarantee a vaginal birth. Biology doesn't work that way. The perfect experience. Some birth plans read like a Pinterest board. Candles, specific music playlist, golden hour undisturbed, immediate bath together. Those things are lovely. If they happen, great. But birth is messy and unpredictable. Sometimes baby needs immediate medical attention. Sometimes you're too exhausted to care about the playlist. Don't set yourself up for disappointment by expecting perfection. Okay, so what should your birth plan actually look like? Keep it short, 1 page. Maximum. Doctors and nurses are busy. They don't have time to read 3 pages. If your plan is too long, they'll skim it and miss the important parts. 1 page. Bullet points. Clear and concise. Use preference language. Don't write, I will not have an episiotomy. Write, I prefer to avoid episiotomy unless necessary for baby safety. Don't write, nobody enters the room except my husband. Write, I'd like to keep visitors minimal during active labor. See the difference? One sounds demanding, the other sounds collaborative. Medical staff respond better to collaborative language. Trust me on this. Show flexibility. Add phrases like, if medically necessary, I understand. I'm open to changing this if circumstances require. I prefer X, but I trust my medical team's judgment. This shows you're reasonable. It makes your team more likely to honor your preferences when possible. Organize by category. Use headers like pain management labor preferences, delivery. Preferences immediate postpartum makes it easy to scan quickly. Include the important stuff. Your name, your partner's name, your OB's name, any medical conditions or allergies. Your top 3 priorities, the things that matter most to you. For me with baby number 2, my top priorities were try unmedicated first, immediate skin-to-skin, breastfeed within first hour. Everything else was negotiable. Having those 3 priorities clear helped me and my team stay focused. A birth plan is useless if nobody sees it. Discuss it with your OB first. Don't wait until labor to show them your plan. Bring it to a prenatal appointment around 36 weeks. Go through it together. Your OB can tell you what's realistic at your hospital and what's not. For example, some hospitals don't allow intermittent monitoring. Some require continuous IV access for epidurals. Some have policies about visitors. Better to know ahead of time. Bring multiple copies. When you go to the hospital, bring at least 3 copies. One goes in your medical chart. One is for your partner to reference. One is for the nurse currently caring for you. Your partner should know it by heart. This is crucial. When you're in active labor, you will not be able to advocate for yourself. You'll be focused on breathing and surviving contractions. Your partner needs to speak up for you. Make sure they know your top priorities. Make sure they understand when to push back and when to let things go. My husband knew my number 1 priority was immediate skin-to-skin. After my C-section with baby 3, they wanted to take her to the warmer immediately. He said, "Can she go on mom's chest first?" They said yes. That 2 minutes mattered so much to me. That's what a good birth partner does. Now the hard part. What do you do when your birth doesn't go according to plan? Because chances are something won't go exactly as you hoped. First, don't blame yourself. If you end up with a C-section, that's not a failure. If you get an epidural when you wanted to go unmedicated, you didn't give up. If you needed Pitocin or your water broken artificially, you didn't do anything wrong. Birth is unpredictable. You did your best with the circumstances you had. Remember the real goal. The goal of birth is not to check boxes on a plan. The goal is a healthy mom and a healthy baby. Everything else is just details. My first birth was nothing like my plan. Emergency C-section, no skin-to-skin for an hour, formula supplementation because my milk didn't come in. But my daughter was healthy. I was healthy. We both made it through safely. That's what matters. Process your feelings. It's okay to feel disappointed if your birth didn't go as hoped. It's okay to grieve the experience you wanted. That's normal. That's valid. Talk about it with your partner. Talk about it with your OB at your postpartum visit. Consider talking to a therapist if the feelings are overwhelming. Birth trauma is real. Postpartum anxiety and depression can be triggered by difficult births. Don't push those feelings down. Process them. But also, find the wins. Even in the hardest births, there are usually moments that went well. Maybe you got your epidural when you needed it and it worked perfectly. Maybe your partner was amazing support. Maybe you got to hold your baby right away even though other things didn't go as planned. Find those moments. Hold on to them. With my first birth, everything was chaos. But my husband never left my side. He held my hand through the whole C-section. He was the one who first told me, "It's a girl." That's what I remember now. Not the failed plan, the love. After my first birth, I was scared to try again. But with my second baby, I approached the birth plan completely differently. I wrote 1 page, just one. It said, pain management. I'd like to try unmedicated first, but I'm open to epidural if needed. Labor preferences. I'd like to move around and labor in the shower if possible. Delivery. I'd like immediate skin-to-skin and to try breastfeeding right away. Everything else, I trust my medical team's judgment. That was it. And you know what happened? I labored for 6 hours unmedicated. Then I got an epidural because the pain was too much. Baby came 3 hours later. I got my skin-to-skin. I got to breastfeed within 20 minutes. Was it perfect? No. Did it go according to plan? Mostly yes. But the difference was my mindset. I wasn't attached to the plan. I was attached to the goal. Healthy baby, healthy me. When I decided to get the epidural, I didn't feel like I'd failed. I felt like I'd made the right choice for myself in that moment. That mental shift made all the difference. With my third baby, I didn't even write a plan. I just told my nurse when I got there, I'd like an epidural when I'm ready, and I want skin-to-skin right away. Everything else, you guys do your thing. That was my whole plan. And it was the most peaceful birth of all 3. Here's what I want you to take away from this. Make a birth plan, but make it simple and flexible. 1 page, your top 3 to 5 priorities. Collaborative language? Discuss it with your OB ahead of time. Share it with your partner. Bring copies to the hospital, and then let it go. Hold your preferences loosely. Be ready to adapt. Trust your medical team. They want the same thing you want, a safe delivery. If something changes, ask questions. Why do you recommend this? What are the alternatives? What happens if we wait? You can be informed and advocate for yourself without being rigid. And if your birth doesn't go according to plan, and it probably won't, not completely, give yourself grace. You're not a failure. You're a mother who did what needed to be done to bring your baby safely into the world. That's courage. That's strength. The plan doesn't matter. The outcome does. Healthy mom, healthy baby. That's the only plan that really counts. Write your birth plan. Keep it simple. Stay flexible. And remember, the best plan is the one that gets you and your baby through safely, whatever that looks like. Tell me in the comments, what's your #1 birth plan priority? What matters most to you? And if you've already given birth, did your plan go the way you expected? I want to hear your stories. Next video, I'm talking about twin pregnancies and how they're different from singleton pregnancies. Because twins change everything. See you there. You're doing great, mama.